Hello, I'm Tim Newton from the Thaiger, and today I'm on a bit of a personal mission. Now I'm 63 and there are a lot of people my age and over who'll be suffering from the problem that we're talking about today. Now I've come to BNH Hospital here in Sathon, one of the best known hospitals in Bangkok. Indeed, such a great reputation around Asia. And today we're speaking to Dr. Sanchai, and he's a urologist. So what are we talking about? You might have an idea. Let's go find about BPH. So here I am with Dr. Sanchai, and it's a great pleasure to have a talk to you. Thank you very much for your time. Now this is a problem that a lot of, well, basically only men are going to face, and even myself at the age of 63. So this is a problem dear to my heart, and it looks like about 50% of men over the age of 60 are going to be confronting this. BPH or BPE? I've seen it as both on the internet.
Yes. Thank you for coming today, Tim.
Thank you.
So BPH is the medical terms. It stands for benign prostatic hyperplasia. So it's the conditions that your prostate get larger and larger and larger, and then they block the urine channels for the flow to come out.
So what it's going to do is it's going to mean that you're going to be getting up more often
More
at
often
night time.
in the night time, more frequent.
Yeah,
Yes.
more frequent, and it's harder to pass urine.
Yes, you need more pressure to push it out.
Okay, so where is the prostate that causes so much problem? Could you describe where it is?
Here we have a model. So the prostate is below the bladder. So it stays between bladder and the urethra. So it actually just designed to block the way of the urine. So it has to be that area. It helps produce the semen, but actually the way out of the urine have to run through the prostate. And once the prostate get enlarged, and you can see the side by side, there's a limited spaces, and it's squeezing the urethra. So it blocked the way out of the urine.
Okay, so in the past, can we have a talk about the past treatments before we get to some very exciting news that you have for us?
Yep.
It used to be fairly radical, almost surgical to cope with this in the past.
Yes. We do have like conventional treatments. You know, when we have BPH, we treat it with medications. And if the medication fails, okay, of course you need to go to do some things. Usually what we had is a surgical procedure. The common ones that people know is called the TURP, T-U-R-P, transurethral resections of the prostate. So what we do, basically you put the camera inside and then you scoop out the excessive tissues by using the electrical wires to scoop it out. And that's the gold standard for several years that we've been doing. But you know, they have a downside, a lot of bleedings. Sometimes they affect your sexual functions, ejaculatory functions affects, yes.
So in the past, is medication or fairly radical surgery. And I think a lot of men, when you describe the surgery and how it's done, they sort of go, oh. And there's obviously a stay in the hospital involved. Mm-hmm. But here at BNH, you do have two much more palatable and interesting solutions. Would you like to describe them?
Yes, luckily that we had two new procedures now available in our hospitals. We would call this a group like a minimal invasive surgery for prostate. And now we have what we call resumes, which is the technology that you use water vapor to inject it into the prostate tissues.
It's a water vapor?
Yes.
Okay.
Injected via small needles into the prostate tissue, and it makes the cells shrink from time to time. That's the first thing. And the second thing we call the iTint, which is a bit newer than the resumes. It just came out a few years ago. So this device is more likely to reshaping the prostate by using a device that like a stent, a temporary stent that replaces in the prostate, and it helps expanding the channels, open up the channels, and the device removed 7 days after.
Right. So can we go through those two treatments? Do both of them have a longevity? How long will they be effective for?
I would say all these two treatments for the whole course, we were talking about 2 weeks started up to 3 months to get a good result. Yes, but usually the times that we're doing is just only 10 to 15 minutes of the procedure. And this is totally outpatient procedure.
So you're not under a full anaesthetic or anything?
It usually a light sedation.
Just a light sedation,
Yeah.
local anaesthetic?
Sedation, not
Just
a local.
sedation?
Yep.
Okay. Well, that's a big change, isn't it?
Yes, comparing between like doing 1 or 2 hours operations, just 15
and
minutes.
probably a full general anaesthetic.
Yes.
So how long could a person who gets either of these treatments look to get some satisfaction or improvement in their situation? How long do you think it will last?
Okay, first thing, the improvement should start it from after 2 weeks up to 3 months, and then you get much more benefits for both of these procedures. And nowadays we have a data about 5 years that there were durabilities is about more than 5 years. We still not know whether it's longer than that because
they're new.
They're new, yes. We have all the data available now like that, and approximate 4% of cases that need surgical retreatment after 5 years.
Doctor, one question I'm sure many men are going to ask about these treatments. After they have the treatment, is it going to have any effect on their sexual performance in the future?
Good question also. Long before, when we have the traditional treatment, of course there were some downside about this, like retrograde ejaculations and possible some sexual dysfunctions afterwards. But according to the statistic for the minimal invasive surgeries, either Rezum or iTint, it found that there's no report of any sexual dysfunctions afterwards. Even retrograde ejaculations were very minimal cases detected. So I think it's quite very good in terms of saving sexual functions.
So doctor, these two treatments, they're both, as you said, very new. I understand that the latest treatment is only available in all of Asia here at BNH.
Yes, luckily we have iTint procedure, like first places in Asia for iTint. So now we have both iTint and Rezums. Yes.
Now, depending on the patient, would you be suggesting one or the other? Are both treatments uniquely suited to one particular patient or another, or they're both suitable for both?
Very good questions. For these minimal invasive, it has to be, I would say, case by cases. Case selections is very important. So you have to be specified which case would be suitable for which treatments. So I would say iTint were a bit more less invasive than Rezums, but they have a lot of limitations, like this prostate size or this area is too big, then you could not do it.
Okay.
So this has to be judged.
Every prostate is different.
Yes, so it has to be precise judgment.
So when the older people get onto the internet, they understand that with prostate issues, there's also the possibility that they may have to face in their life of prostate cancer. Is there any link between BPH and prostate cancer?
Very good questions. BPH and prostate cancer were totally like separate diseases, but they could be found together. It could be co-finding in the same times. So BPH is just enlarged, it's just one disease, and cancer is just cancer, it's just one disease. So we would recommend that after 45 years old, once a year you should come and check. At least you do PSA tests, you do physical exams.
So obviously people are going to know if they've got problems with BPH. It'd be very apparent to them, can't I tell you? But as far as prostate cancer is concerned, that can really be a creeping, slow disease that they won't know about unless they have proper testing.
Yes, it's one of the silent killers also, because they're not showing any symptoms unless you test it. Yes.
Yeah. So you'd be recommending coming along after 45 years of age at least once a year?
Yes, 45 to 50, depend on your risk.
Okay.
Yes.
So importantly, if people would like to find out about these two exciting new treatments for BPH, and men over 50 or 60 out there, you'll know exactly what I'm talking about. How can I get in contact with the hospital?
We have emails, we have channels to contact. You can call our departments, or you can do like lines many channels to contact.
So as we say on YouTube, you can have a look at the description under the video and all that information will be there. Dr. Sanchai, thank you very much for talking about us, and let's hope that these new treatments can bring relief to a lot of men over the age of 60 in the future.
Thank you for coming today.
And thank you, Tim Newton, here at the BNH in the heart of Bangkok, with some good news for people out there who are suffering or would like to know more about this particular treatment. Thank you.